I never thought I'd be holding, or that we would be holding a hearing under these sad circumstances, but I think it's a necessary one. Our country is in pain. Americans are afraid, they're sick, they're hungry, and jobless, and over 80,000 souls have been lost. And the government that was supposed to protect them has failed. There are heroes, and they have risen. Extraordinary, ordinary Americans showing courage, compassion, and a sense of self-sacrifice and duty beyond what could have or should have been asked of them. Regular Americans have risen when their leaders have not. We are the greatest country on earth, and yet we have the most cases and the most deaths from COVID-19 of any nation in the world. Why? First is the inept, ineffective, and extremely late effort to respond to what was clear to many scientists and public health experts in January. That basic delay cost precious lives and is continuing to cost lives. We can't have a system where the price paid is unconscionable. Mothers losing daughters, daughters losing fathers because of incompetence, denial, delay, and a disorganized response. Frankly, I'm tired of those who bear the responsibility accepting none of it while deflecting blame on others. The previous administration, the World Health Organization, the Wuhan lab, anywhere but where the blame belongs. Second, the United States has and remains dangerously dependent on foreign countries for our supply of critical life-saving drugs and life-saving equipment, masks, gloves, PPE, and ventilators. As a result, we can't treat our own people without relying on China and others to supply us. We can't outfit our first responders, our hospital workers, our nurses, our doctors. We can't care for our own nation in crisis. This surely is a national security issue. I want to thank the gentlewoman from Indiana, Ms. Brooks, for her bipartisan work with me to address the drug supply chain issue, as well as other members on a bipartisan basis for their legislation on those issues as well. Today, we're going to hear about the disastrous federal response to an approaching pandemic. Dr. Bright has filed one of the most specific and troubling whistleblower complaints I've ever seen. He was the right person with the right judgment at the right time. He was not only ignored, he was fired for being right. We can't have a system where the government fires those who get it right and reward those who get it completely wrong. Mr. Michael Bowen, the Executive Vice President of Prestige Meritech, will speak to America's crippling dependence on foreign countries for critical medical supplies, a public health issue and a national security issue. Our country is paying a terrible price today, and it rests on Congress to address this threat where any effort of an adversary can cut off our supply of life-saving drugs and supplies, our lifeline. And this would create a healthcare disaster on a scale never experienced before. I bear this responsibility, as does every member of Congress. This subcommittee has jurisdiction over our country's most prestigious healthcare institutions, FDA, NIH, CDC, and BARDA. We have to listen, we have to learn, and we must work together for the people of our country who need us so, so much, regardless of inconvenient truths. Finally, I regret that Secretary Azar, Dr. Robert Kadlec, and Dr. Peter Navarro have all refused to testify today. I now ask for a moment of silence in honor of the over 80,000 Americans who have lost their lives from COVID-19. We'll now move to member questions, and I recognize myself for 5 minutes for questions. Thank you again, Dr. Bright. You have a distinguished career. You're one of our country's leading public health experts on how to respond to pandemics and national security health threats. You're the first government official who's been on the inside, seen everything firsthand, to come forward and share unvarnished experiences about what really happened from January to the time you departed BARDA in April this year in dealing with the virus. So I want to make sure I understand what you're telling us. You stated in your written testimony, a window of opportunity is closing, but it is not yet closed. What do we need to do with the time left to get it right? And if we don't, what do you mean when you say 2020 will be the darkest winter in modern history?
Chairwoman Eshoo, thank you for your question. The window is closing to address this pandemic because we still do not have a standard, centralized, coordinated plan to take our nation through this response. I believe with proper leadership and collaboration across government, with the best science leading the way, we can devise a comprehensive strategy. We can devise a plan that includes all of Americans and help them help us guide us through this pandemic. But time is running out because the virus is still spreading everywhere. People are getting restless to leave their homes, and we have to make critical decisions on how to balance the economy and science. My concern about this fall is compounded by my knowledge and preparation in response to many years of influenza outbreaks, pandemic influenza outbreaks, and seasonal influenza outbreaks. In our country in 2017, we had nearly 79,000 people die in the US from influenza. That, coupled with a COVID-19 resurgence this fall, could be devastating for our healthcare systems and for Americans. We have a limited window of opportunity to get plans in place to address both of those.
Thank you. When you look at the first 4 months of this year, would you describe the government's and the administration's response as a success or a failure?
I believe we could have done better. I believe there are critical steps that we did not take in time.
Was there a failure to respond when you correctly pushed to claim early virus samples from, or to obtain early virus samples from China so we could develop critical medical countermeasures?
From my perspective in working with companies to develop drugs and vaccines and diagnostic, viral samples are critical. As soon as we were aware that this virus could pose a significant threat to human lives, I began pushing for those virus samples, and I met frustration and dismissal.
And when did you do that?
I did that in the office of the Secretary of Azar in January. The push for the virus samples initially mentioned on January 23rd, and a strong push on January 27th for those virus samples.
And was there a failure to respond with the needed urgency when you correctly pushed to ramp up production of masks, respirators, syringes, swabs?
Congresswoman, we've known for quite some time that our stockpile is insufficient in having those critical personal protective equipment. So once this virus began spreading and became known to be a threat, I did feel quite concerned that we didn't have those supplies. I began pushing urgently in January, along with some industry colleagues as well. And those urges, those alarms were not responded to with action.
Was there a failure to take immediate action when you correctly pushed to acquire additional doses of the drug remdesivir, which is the only drug so far that has appears to be at least mildly effective, thank God, for treating people with COVID-19?
There was no action taken on the urgency to come up with a plan for acquisition of limited doses of remdesivir, nor to distribute those limited doses of remdesivir once we had the scientific data to support their use for people infected with this virus.
And instead of acting on your recommendations, was the response of others to try and cut you out of key meetings, marginalize your participation?
I was told that my urgings were causing a commotion, and I was removed from those meetings.